This is a recorded lecture for Chapter 3 of Information Technology for Health Professionals. In this chapter, we're going to look at an introduction to the administrative assumptions of computers, how we get involved with practice management, patient scheduling, and patient accounting, and facility accounting as well. So we're going to look at those combinations of things and under the guise, or under the umbrella, if you will, of how we use computers within the healthcare system. We talked about medical informatics before, but that's really we talked about that. We really were referring to the mechanism, if you will, of let me get this. I get this work. The mechanism of how that applies, getting information, putting information in, and taking information out. We talked about that in the previous lecture. In this particular area, we're going to really talk about clinical applications. For instance, medical informatics, direct patient care, how we collect information from patients, how we use the information to better treat patients. We use medical informatics to special purpose applications like education of the patient, and also correlation with the pharmaceutical pharmacy prescriptions that we give them. And then administratively, the Office of Materials Management, Scheduling, Accounting, and Financial Applications, so that we can manage our resources, our prosthetics, our resources, all our supplies, in relationship to the flow of our patients. We also can use it in telemedicine. Telemedicine means delivery of healthcare through telecommunications. In 1998, I read a book called The Death of Distance, which really looked at healthcare, and we started thinking about healthcare is not something that occurred within the same room, but could occur from far away. And we started looking at telemedicine as it first started out, which strangely enough was in Nebraska. The University of Nebraska used it from their medical center in Omaha to a psychiatric facility located on an off-site. And they were able to use telemedicine in its very, very most prehistoric form, which is really a video feed back and forth, which allowed them to deliver health care, at least psychiatric health care, to some degree. Now, the administrative application, the practice management software, is really designed to computerize administrative functions in the healthcare environment. So it allows the organization of patient data, case data, provider data. So we can look at the success or not the lack of success of a provider. We start to look at trends, all those kind of things. It enables electronic scheduling, electronic progress notes, the creation of lists of codes for diagnosis and treatment and insurance. So it really automates a lot of things we used to do by hand. Now, administrative applications include office management tasks, patient scheduling, provider scheduling, accounting, and administrative tasks in medical offices include coding and billing, so we get paid for what we do, organizing our information to apply apply for insurance, reimbursement, that kind of thing, as well as payments. Now, practice management software allows bucket billing, which is billing from one insurer after another until the patient is billed. So basically, it allows us to manage that. So organization information in relational databases. So each type of information is organized in its own table and can be accessed easily. So the tables can be linked together, and we can start looking at cross-connectivity between them. This is looking at one of those kind of mechanisms. This office management basically has patients listed here and what time frame. So this is a scheduling portion we see here. This is really the edit the appointment. So we know that we have this for an exam 1, and that's the resource of exam room 1. We'll write our notes in here, case, reason, all that kind of thing. So really it helps us to organize how we treated that patient. And then finally, we look at a list of treatments, if you will, patient transaction entry, which then goes to our finance area, and we can start to collect money. So bucket billing or balance billing is unique to the healthcare environment, and a claim is filled with a primary insurer, and they're responsible, and the checks are received. So claim is filled with a secondary insurer, response to check are received. So in some cases, people have more than one insurance, so there's primary insurance, secondary insurance, and we then take that process from once one is paid, we take it to the next insurer and on down the line. Only after claims have been filed with all insurers and responses received is the patient then billed. So we do all these things first before we bill the patient, because the patient's portion may be much smaller. An organized collection of data created and maintained using database management software is that database, a DBMS, database management software. So that database is really what we have in these software systems. So a file contains related information on an entity. A file can have as many tables, each containing related information, and tables are then linked by a common field into a collective field is called, and tables are made up of those records, so we can put that together. A record contains information on one item in a table, so records are made up of fields. A field is a piece of information in a record. It's one site, if you will. A key field uniquely identifies a record, so that's how we look at those databases. So we look at coding and grouping systems. We have CPT codes, which are procedural codes, and ICD-9s, well, ICD-10s now, but ICD codes, which are disease codes. And so we have procedure codes, disease codes. We have medicine, which are codes for symptoms, and history exams and tests and diagnostics, diagnosis and treatment. We have SNOMED, which provides a common language. And we have LOINC, which is laboratory and clinical notes. And we have NDC, which is a drug area. So all these are codes coded within a system. CMS 1500 is the most commonly used claim form. It's almost become universal among insurers as well as the government. And there's a good look at a CMS form. And this is filled out electronically in most cases. Accounting transactions, including charges, payments, and adjustments, are calculated. A case, the condition that brings a patient to the doctor's office. So we're able to put that together under accounting. We have our scheduling area, which makes appointments to today's medical office, involves electronic appointment book, which resembles kind of the one on the next slide. But the issue is we have to schedule the patient, but we also have to have the schedule of the providers of care and also the staff. So it helps put all that together. This is a good look at that scheduling mechanism. But this would be, let's say, scheduling for a given doctor or provider of care. So he or she would see those patients within that time frame, depending on how they're scheduled. So insurance, that's a type of medical insurance, including indemnity, which is fee for service. It means if you have something wrong, that they just pay it. There's health maintenance organizations, and they're used to HMOs is an acronym for that. And those are insurance agencies that what happens is you pay them a set amount every month, and then they cover your health care. So if you don't get seen by anybody that month, they just collect the money and that's the end of it. But you could be seen like 10 times for the next month, and they still have to pay all of that. There's usually a deductible, meaning you have to pay a certain copay when you come in, and so there's a piece that goes along with that. And there's preferred provider organizations, the PPOs, and again, most HMOs will have a preferred provider group that they've made a contract with, so they don't get overcharged, or they can control the charges. Now, there are different types of medical insurance. There's government insurance that includes Medicare and Medicaid, CHAMP VA, which is VA, the Veterans Association, TRICARE, which goes along with military, CHAMPUS, along with military, and then workers' compensation. Government insurance is administered by the Centers for Medicaid and Medicaid Services, or CMS, and there's the link to that. A claim is a request for payment from an insurer. It can be submitted electronically or on paper. Many systems now are not accepting paper claims anymore. They have to be electronically through what's called a clearinghouse. They get sent to a organization, a company that puts them together and puts those charges together. This is Independence Blue Cross Blue Shield claim form, and this is done electronically also through that system. And there's continue with that. This is the UB04 form for the Blue Cross Blue Shield. Continuation of that. And so the response to claims is an ERA, electronic remittance advice, which accompanies a response to an electronic claim. The EOB, explanation of benefits, explains why certain services were covered and others were not. And sometimes you have to go back and request an alteration of the EOB. So the initial review may say, okay, you can't have this done, we won't pay for it. But in truth, they do pay for it, so you go back and you show them the different situations that suggest they should pay for it. So that's the response to claims you get. Now, bucket billing allows the medical office to accommodate 2 or 3 insurers who must be billed in a timely fashion before the patient is billed. So basically what happens is the relational databases allow information input in one part of the program to relate to information in another part of the program. In a sense, it allows the medical office to bill 3 insurers at one time, but let them see what's going on with each insurer so they can kind of work out the payment in a much faster process. Reports can be generated with the information provided in the relational database. It's a much faster process, like I said. Now, accounts receivable, that's any invoice or payments from the patient or the insurance carriers to the practice in payment of the care provided. And finally, the super bill, and that's the list of diagnoses and procedures that are common to a practice. A super bill is usually a long list that can be filled out very quickly so that the ICD-9 codes are not ICD-9 codes and all such don't have to be written in. They're just basically a check mark or, if you will, that occur electronically. There's a super bill. We used to use these in paper when I was practicing, and basically it had patient information at the top, and you would check all the things that fit what you did with the patient, and you'd sign it, and the patient would go out, and they would charge you for that. Now, the Patient Protection and Affordable Care Act, ACA, if you will, on March 23rd, 2010, the Patient Protection and Affordable Care Act was signed into law by President Obama. The law expands health insurance coverage to 32 million more people by requiring them to buy health insurance. It forces a process of health care for everybody. And that, though there's lots of positives and negatives, what happens if somebody doesn't have health care insurance, they would go to the emergency room primarily to get cared for, even though it may not be appropriate that they go to the emergency room. The cost of care in the emergency room is much higher than maybe a family practice office, but maybe that's the only place they go to. That person who has no money or no way to pay for no health insurance then gets their health care, and it's never paid for, or it's not much of it's paid for. So what happens is that the cost is shifted then to people who actually pay for their health care through insurances and such. So it really forces that to happen. This also expands Medicare, Medicaid coverage, or reforms the current insurance practices so that you can't disqualify somebody for a pre-existing disease. U.S. citizens and legal residents would be required to buy minimal essential coverage, and that's one of the issues that people have. Out of an estimated 25 million people who would be required to buy insurance, about 19 million would be eligible for subsidies. So the bulk of the people can get subsidies, which reduces their health care costs. Anyone with an income below 4 times the federal poverty level, or $22,000 for a family of 4, $10,800 for an individual, or 4 times the federal poverty level, $88,000 for a family of 4, $44,000 for an individual, would be eligible for some sort of subsidy, which would decrease their costs, and that's to help pay for their medical insurance. Anyone with income below 3 to 4 times the poverty level would not have to pay more than 10% of their income for health insurance. So it pushes that into it sort of pushes that health care into a differentiation based on income. The bill closes the donut hole in drug coverage for those over 65 with a $250 rebate in 2010. In 2011, people in the hole could purchase brand name drugs at 50% discount. In 2014, states must expand Medicaid to cover childless adults. So that's the other issue that we're talking about. In 2014, we had to do that. The bill reforms some of the practices of the private insurance industry. Children cannot be denied coverage because of pre-existing conditions. And that was happening sometimes, and so that was a real problem because you could move from one job to another, you get different insurance, and that insurance wouldn't pay for your care because the person had a pre-existing condition. No one could be denied coverage for a pre-existing condition starting in 2014. And children could stay on their parents' insurance plans until age 26. It used to be 18 in some cases. Now, the reports we get are procedural day sheets, we get payment day sheets, we get patient day sheets, we get practice analysis reports, we get patient aging reports. And those are other reports that come out of this electronic system. So you see that office practices, we look at the office practice software and hardware, in this case software, we see that it has many uses both financially, patient management, provider management, billing, and recoupment of payment. This completes the chapter. Thank you very much.